everyone. Thank you so much for joining us to the clinical education webinar series put on by Nerva. We are here today with Nerva co-founder and CEO Alex. I'm really excited to have him presenting. I am Claire. I'm the research lead at Mindset Health. All right, without further ado, I will hand it over to you, Alex.
Thanks, Claire. Hi, everybody. My name is Alex. As Claire mentioned, I'm the co-founder and co-CEO of Nerva. And I'm looking forward to talking to you today about optimizing IBS care with Nerva. Maybe to start, I'll just give a brief agenda overview of what I'm going to be discussing today. So first, I'll talk a little bit about who we are, the story behind Nerva, and then we'll dig into IBS management, the Nerva program, where gut-directed hypnotherapy sits, how Nerva works, the research behind the program, who to refer, how to refer, and then how to discuss Nerva with your patients. So as I mentioned up front, I'm the co-founder and co-CEO of Nerva, but behind Nerva is Mindset Health. So Mindset Health builds hypnosis-based digital therapeutics to help people improve their health. In partnership with Dr. Simone Peters, we developed Nerva to help make brain-gut therapy accessible to people with irritable bowel syndrome via a digitally delivered gut-directed hypnotherapy program. To date, Nerva has helped over 300,000 patients all across the world in partnership with over 11,000 providers, just like yourselves. Part of the story behind this is I have celiac disease, so I had, throughout that journey, thought I had IBS and went through that whole diagnosis experience, but I can really empathize with people who live with IBS, diarrhea, constipation, pain, and have to restrict the foods they love to feel better. This may or may not be new for a lot of people here, but just to start from what is IBS. So IBS is recently reclassified as a disorder of gut-brain interaction. So what this means is, although symptoms may be gut-related, it's not necessarily due to what's happening in the gut itself. It's due to a miscommunication between the gut and the brain and the brain and the gut. What this means is that symptoms can be caused by both physiological factors, so visceral hypersensitivity, changes in motility, infection, as well as psychological factors like hypervigilance, stress, and anxiety. These factors can lead to alterations in the gut-brain axis, which can then lead to symptoms like diarrhea, constipation, and pain. So fundamentally, underlying irritable bowel syndrome is a dysfunction or dysregulation between the gut and the brain. What this means is, one of the best ways to address this and help to tackle IBS symptoms is through brain-gut behavior therapies. And that's why they are recommended by the leading GI organizations in the US, so the American Gastroenterology Association and the American College of Gastroenterology both recommend brain-gut behavioral therapies to help address IBS symptoms from the brain down. Part of this and why this has changed over the last few years is the mountain of evidence supporting both CBT and gut-directed hypnotherapy in helping to address and manage IBS symptoms. One of those studies was done at Monash University by Dr. Simone Peters herself, where she looked at delivering gut-directed hypnotherapy in comparison to the low FODMAP diet, so the gold standard treatment for IBS. And what they found was that gut-directed hypnotherapy was just as effective as the low FODMAP diet, but without requiring any diet change at all. So there are, as I mentioned, two main approaches, which is gut-directed hypnotherapy and cognitive behavioral therapy, and a few others like mindfulness, stress relaxation, and relaxation training. When you put that all together, what we see in the research is that patients respond best with an integrated care model. So one that combines dietary management, medical management, and behavioral management. While most of the time IBS patients have a pretty good time finding dietary and medical management, what we see is that there really isn't a lot of options out there for behavioral management. So most patients maybe would never experience behavioral solutions or have to wait months on the waiting list. I don't know the stat off the top of my head, but I think there's 400 GI psychologists in the world. Just to put that into context, there are 17,000 gastroenterologists in the US alone. So is a niche, it is small, and it's leading to patients not necessarily getting the full whole body holistic experience that they deserve. And if they are, they're waiting months on the waiting list and potentially paying thousands of dollars out of pocket. So that's why we created Nerva. The idea was, could we take best-in-class gut-directed hypnotherapy and cognitive behavioral therapy, and can we deliver that digitally to help the millions of people who are getting diagnosed with irritable bowel syndrome that don't have access to brain-gut behavioral therapies? So Nerva is a 6-week digitally delivered gut-directed hypnotherapy program. Alongside that, we have CBT-based psychoeducation and deep breathing exercises, all designed to help address the gut-brain miscommunication that can lead to diarrhea, constipation, and pain. Nerva costs $199 out of pocket, but there is a 7-day trial and a money-back guarantee. What we hope is Nerva enables patients to access the best brain-gut therapy in the world without the waitlist. So we get this question a lot, like what actually, at the high level that makes sense, it's in the research, it's in the guidelines, but what happens in a Nerva or gut-directed hypnotherapy session? So the way that a session is broken down is across 3 different sections. So this is all audio, think guided meditation in terms of how it's actually delivered. But first, a patient or a user sits down, they close their eyes, they then listen to an induction. So the induction is what brings them into a state of focused and relaxed attention, where they're more open to suggestions, more receptive, and where it's easier to change some of these like automatic processes. While in this state of focused attention and relaxation, we then use guided visualization. So imagine guided imagery, say, you're at a riverbank and the river is flowing fast or slow. So imagery related to gut function that essentially helps to create more normal, gut-brain interactions using the brain's natural ability to rewire itself. And then finally, after the more metaphorical suggestions through the visualization, we use direct suggestions. So these might be helpful suggestions around, gut calming or resilience to triggers or anything like that, more directly said to the user while they're in this state of attention. This helps the patient and their brain and their gut learn to respond automatically to more normal sensations instead of, with an alarm or a pain alarm. So as I mentioned, there's a lot of research in brain-gut therapies, hence why gut-directed hypnotherapy is mentioned and recommended in the clinical guidelines. But more specifically with Nerva, Nerva has been validated in a 244-person randomized controlled trial by Monash University. So they conducted a study where they compared Nerva as it is with an active control that just used psychoeducation. And what we saw was pretty incredible results. For patients who or participants that went through the Nerva arm, 81% of people saw clinically meaningful and significant reductions in their symptoms, compared to 63% in the active control. Even more, a bigger gap is when you look at just the pain. We saw 71% of people in the Nerva arm saw clinically significant improvements, and 35% in the active control saw improvements. So really well impactful symptom reduction and symptom management in participants. But more than just in the controlled setting, and I think this is an interesting thing to call out because most drugs on the market or most approaches have really only been validated in controlled settings. But Nerva has been studied in real users across over 20,000 users in real life settings at home in their life with all the distractions there. And we see very similar results across, significant IBS, symptom management, abdominal pain, gas, bloating, stool consistency. But more than just the, symptoms that patients experience, we see quality of life indicators improve as well. So one of the studies that we ran found that patients or participants reduced their out-of-pocket expenditure by 50% in the 6 months following Nerva than the 6 months prior. So not only is it leading to improvements in their lives and how they feel and the ability to interact in the world, but our members are, spending less money on out-of-pocket costs like supplements and things like that maybe that they don't need to be, or more expensive foods or things like that. So one of the questions we get often is, who is Nerva right for? And it's really interesting in the research, both our research and other research at Monash and other universities into gut-directed hypnotherapy. The evidence is clear. These approaches, and Nerva specifically, is effective for patients with IBS, regardless of subtype. So whether it's constipation predominant, mixed, diarrhea, and regardless of whether it's anxiety driven. And I think this is something to call out. All those patients with, a better understanding of the gut-brain connection, experience butterflies in the stomach as tornadoes and can really understand the gut-brain connection in that way. It doesn't actually matter if they have anxiety and stress triggers or if it's just food or it's undetermined. Nerva is effective regardless. Patients who are specifically, maybe it's works best for patients who are interested in a non-pharmacological or non-dietary approach, or patients who have an eating disorder and can't follow any elimination diets. Patients where it's not appropriate for, or more specifically, we recommend a GI psychologist work with them first, is patients who have a history of severe psychiatric disorders or a history of psychosis or unresolved trauma. As I mentioned up front, Nerva has been widely used across healthcare settings in the US and globally, with over 11,000 healthcare providers from some of the world-leading GI clinics using Nerva. The reason why that they do that is because a lot of these patients are struggling, they're coming back, and there's got unresolved symptoms that they're really looking for support. And Nerva provides an outlet and opportunity that is low risk, it's easy to start. And what we see is patients are much more satisfied. The provider, is much more satisfied. And when patients come back, they're really happy with the experience that they've had and patients improving their symptoms. And that's why a lot of these providers are referring Nerva so often. So we're talking about, who to refer. The next question is how to refer. And so this, if you've been referring, I know a lot of people on the webinar or watching at home or watching the recording have probably worked with Nerva in, maybe just recommending it or saying try Nerva or download the app. And all of those ways in the past have worked well. But we've recently launched our preferred method of referral through an online HIPAA-compliant web form. What we found was, as I experienced this myself, when you go to your provider and they maybe recommend something, they give you a handout, they send you a link, it's so easy to lose it, forget about it. I've gone to my primary care doctor 3 times to get a referral letter to my GI to get my follow-up scope for celiac disease. Not because I'm against it or because of anything like that, it's because I just simply forgot. And so we've launched this web form that improves patient compliance 5-fold, which means patients are experiencing better outcomes, they're sticking to the program more effectively, and they're improving the quality of life dramatically more than these other methods. So super easy, takes 10 seconds. You simply enter their name, their email address. We'll do the rest of the work. We'll answer any questions they have, and patients will receive a 7-day free trial. They'll receive, and this is the only way for them to receive their 25% discount. And if it doesn't work, if they're in the 19% of people who are non-responders to gut-directed hypnotherapy, we have a 100% money-back guarantee. So it's super easy, super low risk. If you have any concerns, reach out. But I recommend bookmarking this, having your admin staff or your support team help you with this, and really working with your patients to make sure that they improve the quality of life that they deserve. Finally, from me, one of the questions that I get personally asked the most is how do I discuss this? I'm bought in, I understand the gut-brain connection. I believe, in integrated care model that supports patients the best, but this is new to me. How do I discuss it? So I've put down a few dot points that I think are the most effective ways to, broach this subject when you're talking about it with patients. So first, discussing and explaining IBS physically. So one of the common complaints people have is, are you saying it's all in my head? And that feels quite dismissive and not reflecting the experience that patients have with IBS. And so bringing up the gut-brain connection and bringing up visceral hypersensitivity and talking about how, it's starting in the gut, the nerves in the viscera around the gut are overly sensitive to normal stimuli, triggering these false alarms to the brain, which then triggers symptoms, starts from that mechanical, physical side, and then brings up the gut-brain connection, which is incredibly important for the next part of the script or the dot points, which is describing how Nerva actually works on that basis. So Nerva is a gut-directed hypnotherapy program delivered via an app that helps you to retrain how the brain and gut communicate with each other, calming the nerve pathways over time so that your normal gut activity stops feeling painful. And so you've built that understanding of the gut-brain connection, and then it's a lot easier for them to understand how Nerva can help with that. Next is just reassuring about credibility. This is probably the first time they've heard of gut-directed hypnotherapy or Nerva. So discussing how, it's recommended by the clinical practice guidelines, discussing Nerva's randomized controlled trial, it's clinically proven, all things that can help them feel confident and, believe in the self-efficacy that this will work for them. Then finally, discussing reducing barriers to trying. Like most patients experience results within 4 to 6 weeks in just 15 minutes a day. Nerve includes a 7-day free trial, money back guarantee. So it's really, there's not a lot of risk. There's just trying it out and seeing if it works for them. Thank you. Those are all my slides. If you have any questions, you have my email at alex@mindsethealth.com. If you want to learn more, our website is nervahealth.com/clinicians. Thank you.
Awesome. Thank you so much, Alex. That was great. We will jump right into questions because we have a few here. Can you expand more on why psychosis and unresolved trauma are contraindicated for gut-directed hypnotherapy?
Nerva is a self-management app, and we think that it's best for people with some of these severe mental health conditions to work with a healthcare professional. And we are not qualified to support that. There is some literature and some research around, visualization and how inductions and things like that may interact with psychosis and stuff like that. But I don't have necessarily the research at hand to talk about that.
And I'll add in as well that specifically around unresolved trauma, that really because it's app-based and you're not working with a one-on-one provider, it's hard to discern, especially in these patients that trauma is unresolved, if that is a primary driver of symptoms. So, it's certainly the Nerva program and standardized gut-directed hypnotherapy programs are not going to be helping with specific trauma for patients and trauma histories. So if the primary driver of symptoms is that unresolved trauma, then they're much better off to be seeing a provider in person for that. If the primary driver, you can discern, or you can work with their psychologist or their mental health team to discern that the primary driver of their symptoms really is IBS, then Nerva could still definitely be appropriate for those patients. Jumping into the next question. Are there certain psychological traits, for example, patients with sort of high GI-specific anxiety or catastrophizing, that predict a better or worse response to gut-directed hypnotherapy?
In the research, there doesn't seem to be predictors of response around, whether they have anxiety triggers or GI-specific anxiety triggers, whether they have, food triggers or X, Y, and Z. In our research, we haven't been able to see that. I think the most likely predictor response is whether they can commit to the program and whether they're open to trying the program. And I think self-efficacy, motivation, those are probably what I would look out for more than specifically, do they have, GI-specific anxiety?
Awesome. Here's another question. This person said, "Thank you, Alex. My patients have really enjoyed the shorter sessions in Nerva. Have you made any more adjustments recently or anything else exciting on the horizon?"
Yeah, so we are working hard at bringing variety to the program. One of the biggest common questions that we have is it's repetitive, and part of that is necessary to help, retrain and ingrain the learnings of the sessions. But we really want to be building towards something that's super enjoyable and effective. And so as part of that, we're launching unique sessions for every day of the program. More in the mid to long term, looking at personalization as our big next feature. How do we personalize the program? Not because it's necessarily more effective if you localize or personalize it to subtype or their motivation, but because people adhere more when it feels like it's about them, talking to them, and some interesting things there.
Can you talk a little bit about hypnotizability? What do providers need to know about that? And how important is it for patients to be hypnotizable in order to see results?
So we think that maybe 15% of people are highly hypnotizable and 15% of people are like lowly hypnotizable, and the rest of the population is somewhere in between. And that really, what we see in the research though, is that hypnotizability isn't necessarily associated with outcomes. So it's not a predictor of response whether you're highly hypnotizable or lowly hypnotizable. I think it's more around, maybe the underlying causes of IBS and things like that. But yeah, it's not a predictive response.
And if you're not familiar with the term hypnotizability or what that is, it's really sort of the depth that you're feeling relaxed or deeply engrossed in the session. So people who are highly hypnotizable, which, like Alex said, is about 15% in the literature, those patients might say that they almost felt like they were asleep during a session. That's the minority of patients who actually go through the program, and like Alex said, we don't actually see that correlate with outcomes. So even if you're sort of someone like me whose mind wanders as they're listening to a session, that's completely normal, and definitely something that the majority of people will experience when they're going through the program. Can you talk a little bit about how providers can get over this skepticism, and specifically, how to talk about hypnotherapy, because it definitely is taboo for many patients?
Yeah, I think once you've done the work, a lot of the work is just upfront in explaining the gut-brain connection, building the foundation of like, how could any psychological therapy be effective for IBS? And once you've done that work, next it's around talking about how gut-directed hypnotherapy works and how it's different to, say, stage hypnosis. A lot of people, maybe that's their only exposure to hypnotherapy, but distinctly talking about how, that is completely different. It's not the same thing. Gut-directed hypnotherapy is in the clinical practice guidelines. It's been proven in over 30 studies to be an effective tool or treatment for irritable bowel syndrome. You're always in control if that's a concern they have. You can sometimes de-risk it by linking it to guided meditation. That is a two-sided coin, because although it maybe de-risks it if that's something they're open to, it also potentially leans into people's fear that you're saying it's all in my head. So maybe, use your discretion when using that analogy. But yeah, I think it is making it feel different from stage hypnosis, and then linking it to the science and the credibility, and then talking through the mechanics of how it could work like I did.
Awesome. Couple more questions here. Can you talk about if patients need to repeat the program if their symptoms return? What does sort of the long-term management look like after 6 weeks, if they've seen success or if they haven't seen success?
The program is structured into components. So there's the 6 weeks, which is like the intensive, where we ask people to do 5 to 7 days a week. And then there's a long-term maintenance. What happens and what we recommend is, say, if you've been listening 5 to 7 days a week, you've been adherent, then the post 6 week maintenance program is tailored to that. So it's really dependent on how adherent you were, the sort of outcomes you've seen. Then you maybe listen less often, once a week or even less. And if you weren't adherent and you want to keep and get the outcomes of the program, it might be listening more often or repeating the program. So probably the post 6 week experience is either twofold. You go through the maintenance program and listen at the tailored like cadence that makes sense based on how much how many results you've seen, how much results you've seen. Or, and what we see often is maybe you stop listening and you have a flare up in a year's time, or something happens. You're going on a big trip or some sort of life event that acts as a trigger for you to come back, redo the program as a refresher, and then, go through that life experience with like confidence that you're going to be okay.
Awesome. And can you talk about the patients that haven't seen success at the end of the 6 weeks? What is, and maybe they have been adherent to the program?
As I spoke about, what we see in the literature is around like 80% of people see clinically meaningful results. And that's like similar to the low FODMAP diet. So there's probably some sort of non-responder rate, the underlying cause of IBS, but we don't really know. what happens for those non-responders is why we have the money back guarantee. Like, we are trying to build a value-based, outcome-based healthcare company that really optimizes for how do we help people feel better. And if they're adherent and they're not feeling better for no fault of their own, we offer 100% money back guarantee. So we'll refund their purchase price and send them on their way. Now, if they weren't adherent, then maybe it's worth trying again, or, you know, going through the maintenance program or something like that. But yeah, for the adherent non-responders, we offer a money back guarantee.
Yeah, and we wouldn't expect them to really see results, because there is that percentage of non-responders in the literature. And if they have adhered well and aren't seeing improvement at the end of 6 weeks, and those patients, we wouldn't really recommend to go do another 6-week program or continue listening. We would really classify them in a bucket of non-responders. And again, you know, go back to the drawing board with their provider on, you know, looking at more multimodal management options. But again, not recommended to continue sort of another course of 6 weeks for those patients. Last question here in the interest of time. Do you have a framework for when providers should be following up with patients? Is there a best framework for, you know, is it halfway through their program? Is it every day? That's crazy, but just as an example, when providers can follow up with patients as sort of a best practice for helping patients through the program.
It's not an easy question to answer because of how many different providers work with us. You know, the answer for a gastroenterologist might be different from a APP, different from a dietitian. And so there's no one size fits all. I think if we just look at the Nerva program, we see just by referring as a provider to Nerva, you're doubling the compliance rate than someone who comes from the like self-guided experience. So you're already helping patients adhere just by referring, especially via the form. Within that structure, patients, there's probably two or three moments where I think it makes the most sense, but it, again, really depends on how you structure your care plan. One is like, you know, have they actually started? So like, you made the referral, it's been a week, did they start? That's probably one check-in moment I think about. The next is around like 4 weeks in, so like maybe 3 to 4 weeks, halfway through the program, where they should start to see outcomes based on the research, checking in to see how they're going. And then at the end of the 6 weeks, you know, we've gone through the program. If they've been adherent, they should have seen the results. Now it's like, okay, what next? What am I supposed to be doing? Whether Nerva or not, seeing how they're feeling and, you know, making updates to your recommendations then.
Awesome. One question just snuck in here at the end that I can answer really quickly before we log off. There's a question about how it compares to Dr. Palson's protocol. I'll just say there's 3 validated gut-directed hypnotherapy protocols that exist. Dr. Palson's and Dr. Warwell's from Manchester and Dr. Peters from Monash, which we use with the Nerva app. They're all pretty similar, to be honest. They're all slightly different lengths, and sessions are offered at different cadences, but the actual content is all very similar across all 3 validated protocols. Okay.
Comment on that though is obviously the only sort of digital mechanism largely where you can find gut-directed hypnotherapy is through Nerva, and although the protocols are very similar, how it is delivered does make a big difference in adherence. So, you know, one of the questions is around like shortening the sessions. Because it is self-guided, like it is so important. We spend so much time and research making the user experience like, you know, amazing, because like that is so important to it for compliance and things like that.
Awesome. And we appreciate the time, and thank you, Alex.
No worries. Thanks for having me.